Welcome to Lex Cura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lex Cura Summit. Unplanned hospital readmissions from home health are more than quality indicators. They can also be important litigation signals. The period between the final home health visit and the hospital admission often reveals whether the patient's deterioration was already visible, whether the agency recognized the change, and whether appropriate escalation occurred. When a patient is readmitted within 30 days with a condition that was reflected in the home health record, the key question is whether the agency identified the risk and responded appropriately. In this episode, I will explain the clinical bridge analysis methodology and show how to connect the final home health findings, the missed warning signs, the escalation response, and the hospital admission diagnosis. Did you know that nearly 1 in 5 Medicare patients discharged from a hospital ends up back there within 30 days? That's a staggering number, and today we're diving into why this happens, especially in the context of home health care, and how it sometimes leads to negligence cases.
That's a huge statistic, and it's not just about the inconvenience or the cost. It's about what that says about the healthcare system as a whole. So where do we start with this?
Well, let's start with the basics. When we talk about home health readmissions, we're looking at patients who are discharged from a hospital and sent home with a care plan. Often they're under the supervision of a home health agency, but if they end up back in the hospital within 30 days, that's considered a readmission. And it's not just a healthcare issue, it's a financial and legal one too.
Right, because hospitals can face penalties from Medicare for high readmission rates. But beyond the financial side, it's also a sign that something might have gone wrong in the care process. What are some of the main reasons patients end up back in the hospital?
One of the biggest reasons is poor communication during the discharge process. When a patient leaves the hospital, there's supposed to be a clear plan for their care at home. That plan needs to be communicated to the patient, their family, and the home health agency. If there's a breakdown in that communication, things can go wrong pretty quickly.
And it's not just about giving someone a piece of paper with instructions, right? It's about making sure they actually understand what they're supposed to do. Health literacy is a huge issue. Many people don't have the background knowledge to make sense of medical jargon or complex care instructions.
Exactly. Imagine being told you need to take multiple medications at specific times, follow a strict diet, and do physical therapy exercises, but no one takes the time to explain how to do all that in a way that makes sense. It's overwhelming, and it's easy to see how things can fall through the cracks.
Another big factor is the quality of the home health care itself. Not all home health agencies are created equal. Some have highly trained staff and robust systems in place, while others might be understaffed or poorly managed.
And when the care isn't up to par, it's the patient who suffers. For example, if a nurse misses a follow-up visit or doesn't notice the signs of an infection, that could lead to a readmission, or worse.
Then there's the issue of social determinants of health. Things like poverty, lack of transportation, or living in a food desert can make it really hard for patients to follow through with their care plans.
Exactly. If you're supposed to eat a special diet but can't afford the right food, or if you're supposed to attend physical therapy but don't have a way to get there, your recovery is going to suffer. And these are systemic issues that go far beyond the individual patient.
And let's not forget about technology. Electronic health records, telehealth, and remote monitoring devices have the potential to improve care and prevent readmissions. But if those tools aren't used effectively, or if they're not accessible to everyone, they can also contribute to the problem.
So when you combine all these factors, it's easy to see how things can spiral out of control. And that brings us to the legal side of things. When a patient is readmitted, it raises a lot of questions. Was the discharge plan clear? Did the home health provider follow through? Were there signs of a problem that were ignored?
And those questions can lead to negligence cases. Families might feel that their loved one's suffering could have been avoided if the care had been better. Attorneys will look at these readmissions and try to identify where the system failed.
Negligence, in this context, usually means that someone failed to meet the standard of care. That could be the hospital, the home health agency, or an individual provider. If that failure leads to harm, like a readmission or worse, that's when you start to see legal cases.
And proving negligence isn't always straightforward. You have to show that there was a duty of care, that the duty was breached, and that the breach caused harm. It's not enough to just say, this patient was readmitted.
Exactly. Attorneys will look for specific evidence. Was there a documented care plan? Were there notes from home health visits? Did the patient or family report any concerns that went unaddressed?
And it's not just about what's in the records, it's also about what's missing. If there are gaps in the documentation, that can raise red flags.
It's a high-stakes situation for everyone involved, and it raises some big questions about accountability. Who's responsible when a patient falls through the cracks?
It's a shared responsibility, really. Hospitals, home health agencies, individual providers, and even patients and families all have a role to play. But the system has to support them in doing their part.
And that's the challenge, isn't it? Creating a system that's not only efficient, but also compassionate. One that prioritizes patient safety and well-being above all else.
It's a tall order, but it's not impossible. There are already initiatives aimed at reducing readmissions, like better discharge planning, improved communication, and the use of technology to monitor patients at home.
And there's also a growing awareness of the importance of addressing social determinants of health. Programs that provide transportation, meal delivery, or home modifications can make a big difference.
It's a step in the right direction, but there's still a long way to go. And as long as there are gaps in the system, there will be cases of negligence and the lawsuits that follow.
It's a sobering thought, but it's also a call to action. Whether you're a healthcare provider, a policymaker, or just someone who cares about this issue, there's work to be done.
Absolutely, and it starts with awareness. Understanding the problem is the first step toward finding solutions.
Well, I think we've covered a lot of ground today. Any final thoughts?
Just this: healthcare is a human endeavor. It's messy, it's complicated, and it's never going to be perfect. But that doesn't mean we shouldn't strive for better. For the sake of the patients, the families, and the providers, we have to keep pushing for change.
Well said. Thanks for the conversation. And thanks to everyone listening. We'll see you next time.
Take care.
Thank you for listening to Lexcura Clinical Insights. The clinical bridge is built by reading the home health and hospital records as one continuous patient journey. The analysis should compare the patient's condition during the final home health visits with the symptoms, findings, and diagnosis documented at hospital admission. It should also examine whether the agency recognized deterioration, notified the physician, changed the plan of care, arranged an urgent evaluation, or failed to escalate. A readmission alone does not establish negligence. The strength of the case comes from showing that the condition leading to hospitalization was identifiable in the home health record, and that a timely response could have altered the outcome. When that connection is supported by the chronology, the clinical bridge may establish notice, breach, causation, and resulting harm. For more clinical intelligence, litigation analysis, and practical guidance, visit Lexcura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll